What if I told you the U.S. government once ran a 40-year experiment on black men without their consent? From 1932 to 1972, the Public Health Service partnered with the Tuskegee Institute to study the effects of untreated syphilis. They recruited 600 black men in Macon County, Alabama, told them they were being treated for bad blood, and then did nothing. Even after penicillin became the cure, they withheld it just to watch the natural progression of the disease. What were they promised? Only what most poor black men could only dream of. Well, in terms of medical care and survivor's insurance back then, their incentives included medical exams, medical transportation, meals on examination days, free treatment for minor ailments, and guarantees that burial stipends were paid to their survivors. In 1972, the truth came out. A panel declared the study ethically unjustified. A class action lawsuit followed, and in 1997, President Clinton issued a formal apology to the survivors and their families. This was not a conspiracy theory. It's documented history, and it changed medical ethics forever. If you've ever wondered why some communities distrust the medical system, remember Tuskegee.
Hello and welcome back to my YouTube channel. I'm your host, Wamara. In this particular video, we'll be taking a deep dive into one of the darkest moments in American history. This is a period of time in which the American government conducted various experimental research on the black American population. For this video, we'll be talking about the Tuskegee Syphilis Study on black American males. In this particular study, medication or rather treatment was withheld deliberately from black American males that were known to have latent syphilis. This led to various implications, including congenital deformities in children, death, and other healthcare complications that resulted from syphilis. So kindly, in this particular video, we'll be discussing what happened, why whatever happened was atrocious, how whatever happened impacted medical research and ethics, and why accountability is really important till date. So kindly sit back, grab your cup of coffee as we learn in this particular video. If you are new to my channel, kindly subscribe and share or like the video.
This is part 5 of the U.S. government experimenting on people of color. Today we're going to talk about the Tuskegee Syphilis Study. This is the 3rd time I've tried to record this. I've recorded it in its entirety twice, and then after I'm done, it just disappears. Y'all not getting me, bitch. I'll record it as many times as I have to. Thank you. Anyway, this is one of the more well-known instances of government experiments, but it'll never be known enough, so here we go. So first, let's just cover what is syphilis. It is an STI. It is an infection caused by bacteria, most often spread through sexual contact. It can cause permanent damage to your organs if left untreated and can be life-threatening. Now that we have that out of the way, the time is 1932. There was no known cure for syphilis. 600 African American men in Alabama were enrolled in a project where the objective was to study the full progression of the disease. These 600 men were promised free medical care in exchange. So of these 600 men, 399 of the men recruited already had syphilis. I think this story gets confused with others where the people were injected with STIs. This is not that. This is where they sought out men with a later stage of this disease to just watch them and deny them any medication, any help, any penicillin, which we'll get to that part. But the goal was to deny them of anything and to just watch the disease progress until it killed them. The participants, everything I see list them as participants. I'm going to say victims. It sounds fucking crazy to say participants. They didn't know what the fuck they were agreeing to. The victims did not know. The victims thought they were going to be treated for this, and we'll get to that. We'll get to it. So 399 of the men had syphilis, and many had never been to a doctor before. So it makes sense why they would agree to participate, as they were told they were being treated for bad blood, which was a term commonly used at the time, but it referred to a variety of ailments. So they were just told they had this vague issue and that they were going to try to treat it. So the remaining 201 out of the 600 did not have syphilis, meaning they were the control group. According to these physicians, black men were especially prone to this disease due to lust, immorality, and barbaric tendencies. Not because they had little to no access to clean living conditions, health care. No, they're just lustful. What? Which leads me to black people, specifically black women, have always been incredibly hypersexualized and seen as these like super hypersexual beings and oversexualized even as children. And this belief that black people had higher rates of STIs due to being lustful plays a huge factor in that. They were literally denied sanitary living conditions, denied education, denied health care, and then blamed for it and called lustful and immoral. Please. These men were monitored by healthcare staff, but they were only given placebos like aspirin and mineral supplements. So they're being told, oh, this is for your bad blood. Here, this will help. And it was fucking aspirin, just so they thought they were getting treatment. Penicillin became the recommended treatment for syphilis in 1947, which was about 15 years into the study. Yeah, the study was still going on. These researchers convinced local doctors in the area to not treat the participants because it would fuck with the research. The researchers' goal was never to test different medications to manage the symptoms or to find a cure. They just wanted to track the full progression, meaning they wanted to basically see how bad it gets before the disease eventually became fatal. With that being said, researchers provided no care as the men went blind, medically insane, experienced organ failure, and eventually died. In the 1960s, after the experiment had been ongoing for 30 years, a PHS venereal disease investigator from San Francisco named Peter Buxton, I might be saying his last name wrong, found out about the study and was like, this is low-key the most evil shit I've ever seen in my life. This is actually really unethical and immoral. What the fuck is this shit? So he reported it. Boom. So after reporting it, PHS officials formed a committee to review the study, and they ultimately decided that it was perfectly fine and allowed it to continue. The goal was to track all participants until they died, and then they would perform autopsies on them to analyze in what ways the disease affected them and ultimately killed them. Buxton was still unconvinced that this was ethical, so he leaked the story, to a friend of his who was a fellow reporter named Gene Heller. Heller published the story in July 1972, which caused public outrage. This outrage is what forced the study to shut down, which of course it took a white man complaining to a white woman and then publishing it together, and that's what got it shut down. Anyway, by the time the study shut down, 28 men died directly from syphilis. 100 men had passed away from syphilis related complications because late stage syphilis can lead to brain damage, nerve damage, heart failure, blood vessel issues, liver problems, and more. 40 of the spouses of these men were infected and diagnosed, and the disease had been passed to 19 children during childbirth. In 1973, this is so fucking frustrating. In 1973, Congress held hearings regarding this experiment, and in 1974, the study's surviving victims, along with the heirs of the deceased, received a $10 million payout. The $10 million settlement was divided into 4 categories. The remaining living group victims received $37,500. Heirs of the deceased received $15,000. Living control group victims received $16,000. Heirs of the deceased control group victims received $5,000. I don't give a fuck or a shit or a damn what the payout is. There is no price you can put on decades of trauma and medical abuse, which was literally passed on to their children. Please. There's no way to fix what they did, but I think a start would be the researchers dying by firing squad. Anyway, like I said, I've seen this story get mixed up and kind of blended with other stories where people and children of color were injected with STIs to then study the disease. This is not that. This is where they sought out men with the disease, tested them for it, told them they had bad blood so they could watch the disease kill them. This is what that is. The more and more I do this series, the more fucking frustrating and upsetting it is, but that's why I'm doing it, because this shit is pure goddamn evil, and it needs to be talked about as much as possible.
Hello family, from the videos we've just watched, it is quite evident that various atrocities were committed against the Black American population. and specifically the Black American male in this particular study. In the Tuskegee Syphilis Study on Black American male, 600 Black Americans from Macon County in Alabama were recruited for the study. Amongst these 600 individuals, 399 already had latent syphilis. On the other hand, the remaining 201 individuals didn't. It should be noted that for the 399 individuals that had latent syphilis, they were never informed of their medical status, or rather, the condition in which their health was. They were never told that they had syphilis. And this is very, very sad. During recruitment, they were lured into the study with various promises. One, they were told that they would be given free health care. They were told that they would be given meals, and they were also told that they would have access to free exams, medical exams. However, as the study commenced, and the study, as we've said, aimed to observe the natural progression of syphilis in human beings. But for this particular study, it was specific to Black Americans, to the Black American community. And as the study commenced, they were promised a lot of good things without total disclosure of what was really going on. During the experiment, they were treated inferiorly. And even after the discovery of penicillin, even after it was officially the standard treatment for syphilis, these particular individuals that were in this particular study were denied access to such medication. Healthcare providers were informed not to treat these people with penicillin, and this only meant that their health derailed. They suffered complications from syphilis. Since syphilis is a sexually transmitted infection, it means spouses to these particular men were also infected. And to make things even worse, children that were products of individuals who had syphilis also suffered the consequences by being born with congenital syphilis. This was very atrocious and serious, to say the least. Of importance to note in this particular study is the racial and systemic political injustices that the Black American community has faced in the United States of America. In this particular study, it was racially geared. In this study, the study participants of choice for the study were poor, rural African American men with very limited access to health care, or rather health information. And with this limited access to health information, they weren't able to read. Even after the release of penicillin as a major treatment for syphilis, these people weren't able to read. In as much as the information was already relayed to the general public, they weren't able to read and to know that there was cure for whatever they were suffering from. Additionally, they weren't able to tell whether they were suffering from syphilis because they weren't able to discern the various signs and symptoms that were being advertised to the general population. Therefore, I opine that the government exploited the various social determinants of health, such as poverty and literacy of individuals, because these are very serious and important factors that affect, or rather determine, the quality of life that an individual lives. And considering that the study was targeted towards the Black American community, particularly poor Black Americans and African Americans. Notably, Tariafello Clark said, the rather low intelligence of the Negro population, depressed economic conditions, and the common promiscuous sex relations not only contribute to the spread of syphilis, but the prevailing indifference with regards to treatment. In reality, the promise of medical treatment usually reserves only for emergency among the rural black population of Macon County, Alabama, was what secured subjects' cooperation in the study. With all that said, there was some official redress in this particular story, or rather particular case. A class action lawsuit led to the settlement in the mid-1970s that provided payments to survivors, their heirs, and in 1997, President Bill Clinton publicly apologized at the White House, calling the study shameful and grievously wrong. Those gestures mattered, but many argue they don't come close to repairing decades of harm or fully restoring trust. Family, what are your thoughts on whatever happened? Kindly leave, let's discuss that in the comment section. To continue, it's also very important to note how this particular study has contributed to current healthcare systems with regard to ethical practice and research, particularly health research in healthcare. However controversial as this particular research was, we also have to acknowledge that it played a major role in bioethics and medical ethics. It is through this study that various ethical standards came to existence. This particular study has contributed so much to the ethical aspects of medicine and healthcare. It is through this study that exposed various ethical principles and the need for such principles, particularly beneficence, non-maleficence, justice, and privacy and confidentiality. In this particular case study, or rather experiment, there was no consent was sought. The study did more harm to these participants than the good it did to these particular people. Therefore, there was no maleficence, no beneficence observed. And the study involved a lot of maleficence, causing a lot of harm to the participants, their family, and even generations after them. It is also important to note that through this study, various standard operating procedures for medical ethics came to place and existence, and credit is given to the Black American community for that. Thus, this particular study has really contributed towards better, safe, and accountable research studies among the human population. If you liked this particular video, kindly subscribe to my YouTube channel, hit the notification bell so that you are notified whenever I post more videos. Hit the share button and also like.